Edutainment Studios welcomes you to Preventing Allergies, Stopping Symptoms Before They Start. This module is part 2 of a 4-part series on preventing allergies. Allergies are an overreaction of the immune system to substances that generally do not affect other individuals. Allergic reactions range from merely bothersome to life-threatening. Some allergies are seasonal, like hay fever. Allergies have also been associated with chronic conditions like sinusitis and asthma. Allergies can generally not be prevented, but allergic reactions can be. Once a person knows they are allergic to a certain substance, they can avoid contact with the allergen by utilizing a number of different strategies depending on the type of allergy one has. In this course, the objective is to help you understand how allergies are diagnosed. To diagnose your allergies, your doctor may have already done a physical exam, as well as ask questions about your symptoms and medical history. If you're visiting a specialist, like an allergist, for the first time, he or she may recommend tests to help figure out what you're allergic to. The most common test is the skin prick test. With this test, small bits of different allergens are put into your skin by making tiny pricks on your arm or upper back. After about 15 minutes, a small bump will appear where you were pricked with something you are allergic to. Your doctor could also recommend other tests to diagnose your allergies. Your doctor may find your symptoms are caused by one or more common allergens like grass, tree, and ragweed pollen, which is seasonal. Pollen is released into the air by trees, grasses, and weeds at certain times of the year. Depending on where you live, weather affects how much pollen is in the air at any time. The amount measured is called a pollen count. In America, 75% of people who have pollen allergies are allergic to ragweed pollen. If you have one type of pollen allergy, you're more likely to develop allergies to other types as well. Mold can be seasonal or year-round. Some molds give off allergens in their spores, which are single-cell seeds that will become new mold. These molds grow indoors year-round and outdoors during certain seasons. Indoors, mold grows in dark, warm, humid places like damp basements, bathrooms, trash bins, and humidifiers. Outdoors, you'll find mold in moist, shaded areas such as soil or fallen leaves. Dust mites are year-round. These are microscopic bugs that live in ducts indoors. Dust mites do best in soft, warm, humid places like your bedding, stuffed animal, and carpet. Pets are also year-round. Dander, dried skin flakes, and saliva from animals can contain proteins that can cause your symptoms. You can also be allergic to urine of guinea pigs and rodents. Cockroaches are year-round. Cockroach bodies, droppings, and saliva contains proteins that you can be allergic to. You will often find cockroaches in older homes, cities, and crowded areas, no matter how clean they are. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 4-part series on preventing allergies, and please join us for part 3.